Okay, so the aim of this is to explain to you how drug metabolism works. We've talked about this previously in pathology. You should have also covered this, hopefully, if you've done some pharmacology at some stage. So if you look at the amount of drug in the body, we're talking about how this declines over time due to the metabolism of it. So what we've got here is a time on measuring 0, 4, 8, 12, 16, 20 and 24 hours. We're starting off with a 500 milligram dose, so everything starts the same. Now if you have no metabolism, obviously this doesn't change over time, so this one equals the value in the previous 4 hours because it's not changing over time. So if we look at what happens over time, obviously as we go over time, all we see is that nothing is happening, the value is staying the same. So over a 24-hour period, no metabolism, the amount of drug in your body stays the same. So if we take a normal metabolism for a drug and we assume a half-life of 4 hours, so that means whatever we've got after 4 hours will equal the amount we had in the previous time divided by 2. So after 4 hours we'll see a drop to half of the level. Then after another 4 hours, this drops another half of the previous, another 4 hours, half of that, half of that, half of that, half of that. So you can see that by the end of 24 hours, with the half-life of 4 hours, we end up with virtually nothing. So say we have somebody with a fast metabolism, they get rid of the drug 4 times as quickly, so that means the amount here will not be half, but an eighth. So you can see the amount of drug drops much more rapidly, 4 times as quickly. And then if we look at the trace all the way through, you see that essentially you've got nothing left after 8 hours, the same that it would take 24 hours to normally. Now obviously if you've got a slow metabolism, 4 times slower, well in this case it's the amount divided by 1.19, the cube root of 2. Everything happens 4 times more slowly, and what we see is a much slower decrease in the drug over time. Yeah, and what we'll end up with is seeing that to get to half the level takes us around 16 hours, and that's 4 times longer than it would take to get half the drug, and we've still got a lot of the drug left after 24 hours. So that shows us our standard curves. These are exponential decreases over time, and this shows what happens if you take on 1 dose of the drug and how it declines over time. Now what becomes important is, obviously if you're taking a drug and the amount's declining, you want to take more of it to make sure it stays in your system and you get the effect of it. So that's why with standard drug treatments you'll get told take 500 milligrams every 4 hours. So we can again use this to see what happens. So if we get rid of what we have seen happen. So after the first 4 hours, our normal metabolizer has halved, our fast metabolizer has gone down 8-fold, and our slow metabolizer has gone down an 1/8 of that rate. So okay, what happens now is we give more drug. So at this time point we add to the previous end of the previous time point the original amount of drug, again our original dose, and we can fix that so that doesn't change. We always add the same amount every 4 hours. So obviously no metabolism, we've doubled the amount of drug you've got in your system. Normal metabolism, we've gone up 500 milligrams from that level, so we're now 750, and again we can follow that through with the other 2. And what you can start to see is if we then copy this and say what happens to that after another 4 hours, we go down by the appropriate amount. So our non-metabolizing just stays the same, obviously. Again, our slow metabolizer has lost an eighth. Our fast metabolizer, sorry, our normal metabolizer has lost half of that, so it's gone from 750 to half of 750, and our fast metabolizer has gone down by eightfold. And now we can start to see there's a big difference in the amount of drug in the system for people depending on their metabolism of the drug. So let's go through and follow this through. After 8 hours, we're going to take another amount. So we can copy this and see we get an extra 500 milligrams to each patient. We then metabolize it in the same way. And you can see our non-metabolizer is climbing. Our slow metabolizer is also climbing pretty quickly. Our normal metabolizer is going up, but it's stabilizing. And our fast metabolizer is staying with very little in their system. And we can do the same. Give them another dose of drug at 12:01 hours, and then see what happens when we go to 16 hours. And carry that through. (16:01). Take another dose. 20 hours. Let's see what happens after metabolism. (20 hours in a minute). We take another dose. And 24 hours. We see what's happened. So what you can see from this is, depending on your metabolism, the level of drug in the body of these people is massively different. Obviously, if you don't metabolize it at all, it just builds up and will become incredibly toxic. If you're a normal metabolizer, we've stabilized because we're giving 500 milligrams and we're losing about half of that. After 4 hours, we go back to 500 and we'll get a stable variation between 1,000 milligrams in the system and 500 4 hours later. So that's the stabilized level of taking that drug. In the case of the fast metabolizer, we still have very, very little drug in the system at the end of each 4 hour period, only 71 milligrams. So actually the drug average level is much, much lower. And of course, what you can see for the slow metabolizer is it's building up to more than twice the average level we have in the normal metabolizer. This is very, very important, therefore, because therapeutically some drugs become toxic quite quickly. For example, paracetamol. Your dosage of paracetamol, which is effective, is around a 1 gram loading. This is your kind of kinetics that you get with paracetamol. 500 milligram dose, and then you metabolize half of it. Remember, if you get too much too much paracetamol in the system, you'll end up with liver toxicity and your liver will give up and you'll die. Or you end up with taking your drug and having so little effect, it doesn't do you any good at all. So metabolism and understanding metabolism and how this is affected has a very big effect on dosing people and giving them the correct dose that matches what's going on.